Hi, I'm Dr. Barry Duncan, author of What's Right With You and director of the Heart and Soul of Change project. Check us out at heartandsoulofchange.com. I'd like to talk to you just for a couple of minutes about getting results in your therapy and what's called the Partners for Change Outcome Management System. It improves outcomes in mental health more than anything since the beginning of psychotherapy. Sounds too good to be true? Well, it's not. And to drive this point home, I want to tell you about the death of our first president, George Washington. He went on a routine ride every morning across his Mount Vernon estate, and one cold, blustery December morning in 1799, he developed a sore throat after his ride. So he went to bed, and an area physician was summoned, and they came and administered the standard of care of the day. Washington's condition grew worse, and he became unconscious. A second physician arrived, and they re-administered the standard of care of the day, and by the next day, Washington was dead. And of course, you know that standard of care of the day was bloodletting, and while people may disagree about whether it hastened his demise or caused it, it certainly didn't do him any good. But think about what happened there. They continued to re-administer the same treatment despite results that it wasn't working. And that's exactly what happens in mental health today. And that's what the Partners for Change Outcome Management System completely solves. It brings to everybody's awareness when treatment isn't working so something different can be done. Because it doesn't matter how right the approach is, it matters whether or not you respond to the treatment the way that you would like to respond. So how is this done? It's really quite simple. It involves two 4-item scales that look at your perception of whether or not you're benefiting from the treatment and your perception of whether or not the treatment is a good fit for what you're looking for. That's all there is to it. It takes less than 5 minutes of the session for you to give this kind of feedback, but it'll let your provider know and allow him or her to discuss with you when things aren't going well so that you can change it up a bit and try different ideas. And if it's not the right provider for you, to go on to somebody else so you don't languish in treatment with someone who's not a good fit for you. That's really all there is to it, and if you think about it another way, it's a way for your voice to become central in all care that you receive, which totally makes sense. You're the consumer of the service. It needs to fit what you're looking for, so it privileges your voice and keeps your viewpoint center throughout the process. And this process dramatically improves treatment outcomes in mental health. In a variety of different studies that have looked at this, and now there are 9 randomized clinical trials, the way that science looks at outcomes, that shows that when you add feedback from the consumer about the benefit and fit of services, that it improves outcomes dramatically. We did a randomized clinical trial in Norway with couples, over 400 people. In fact, it's the largest randomized clinical trial of couples ever done. And what we found is that couples in the feedback condition achieved clinically significant change at 4 times the rate of those couples in the non-feedback condition who didn't use the outcome rating scale and the session rating scale, those 2 brief forms that I showed you earlier. In fact, those couples that had feedback and used these forms as part of their treatment achieved a 46% less divorce rate at 6-month follow-up. So if that makes sense to you and you would like to search out a provider that uses these measures, that has this kind of a viewpoint, that solicits your viewpoint in each and every session to make sure you're getting what you're looking for, go to the website and go to the top right-hand side and click on Directory. And there you'll find clinicians all over the planet that think this way. Thanks a lot.